All right, what I'm going to be demonstrating is the Limbopelvic Manipulation, or high velocity thrust technique, also known as the Sabuka Slam. And they studied this in an article titled Limbopelvic Manipulation for the treatment of patients with patellofemoral pain syndrome, developing a clinical prediction rule. And this was written by Christine Iverson et al. So what they did is they tested this Limbopelvic manipulation on patients who had patellofemoral syndrome to develop a clinical prediction rule. And they reported in this study that patellofemoral pain syndrome who demonstrated, or the patients who demonstrated a side-to-side difference in hip internal rotation range of motion greater than 14 degrees and were treated with this Limbopelvic or Sabuka Slam manipulation, they had an 80% post-test probability of experiencing a positive outcome or a decrease in pain. We learned in class that the other clinical predictor rules are navicular drop greater than 3 millimeters. Like I said before, the hip internal rotation difference of greater than 14 degrees, which was reported to be the most important. Squatting is the most painful activity, and greater than 16 degrees of ankle dorsiflexion. And then the fifth one is no stiffness with sitting greater than 20 minutes. And three out of 5 of these clinical predictor rules, you have a good probability of a positive outcome, and then if you had 4 out of 5, you have an excellent probability of a positive outcome or a decrease in pain. So the position of the patient, I'm going to take his lower extremities and move him away from his pelvis. His pelvis is going to be resting up against me, and I'm going to position his trunk away as well. I'm going to have him reach behind his back, reaching as far down his neck as he possibly can while interlocking his hands. And I'm gonna just roll up his sleeve so hopefully his deltoid will stick to the table. Take my left arm, I'm gonna wrap it around and stick it between his left arm. And I'm gonna take my right hand or arm, I'm gonna place it on the pelvis here. And now when I'm gonna bring him to a tissue restriction, I'm gonna have him breathe in, and I'm gonna have him breathe out. And after the end of the breath, I'm going to apply that high velocity thrust.